Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study on nonconvulsive seizures and nonconvulsive status epilepticus in dogs and cats with a history of cluster seizures. This research sheds light on a challenging aspect of veterinary neurology, offering insights into the prevalence, detection, and clinical importance of these often overlooked seizure types. Our story begins with the understanding that nonconvulsive seizures and nonconvulsive status epilepticus are types of epileptic seizures characterized by electrographic seizure activity on an electroencephalogram, or EEG, without the prominent motor movements typically associated with seizures. Instead, these events may manifest as subtle or absent motor signs, but often include altered mentation. The clinical features can be quite variable, ranging from impaired consciousness and subtle twitches to behavioral changes and autonomic signs. To understand the scope of these conditions, it's important to define some key terms. An electrographic seizure is identified as epileptiform discharges on an EEG lasting at least 10 seconds, or any pattern that evolves in frequency, location, or morphology. Electrographic status epilepticus, on the other hand, is an electrographic seizure that persists for more than 10 minutes. The term nonconvulsive simply indicates that these electrographic seizures and status epilepticus occur without significant motor activity. In human medicine, nonconvulsive seizures and nonconvulsive status epilepticus are frequently observed, often contributing to coma and altered mentation in a significant percentage of intensive care unit patients. However, in veterinary medicine, data on the prevalence of these conditions has been limited, with only a few case reports and a small retrospective study providing insights. The largest of these previous studies reported electrographic seizures and electrographic status epilepticus in 20% and 12% of dogs and cats with suspected seizure activity, respectively. Notably, a history of cluster seizures was found to be associated with a higher risk for electrographic status epilepticus. Cluster seizures, defined as two or more seizures within a 24-hour period, are relatively common in veterinary medicine. Studies have reported their incidence in a wide range. Cluster seizures can potentially evolve into status epilepticus. Research indicates that patients experiencing cluster seizures face a significantly elevated risk of convulsive status epilepticus compared to those with non-clustered seizures. Given this background, a team of veterinary researchers set out to investigate the prevalence of nonconvulsive seizures and nonconvulsive status epilepticus in dogs and cats with a history of cluster seizures. They hypothesized that a potentially high risk of these conditions exists in patients with seizure clusters. To conduct their study, the researchers performed a retrospective analysis of medical records from the Department for Small Animals between June 2021 and December 2022. They searched the Neurology Service Database for the term seizure and included patients with a documented history of cluster seizures, as well as information on the timing of their last clinical seizure activity, physical and neurological examination results, diagnostic testing outcomes such as laboratory tests, EEG, magnetic resonance imaging findings, cerebrospinal fluid analysis results, diagnoses, treatments, and outcomes. Electroencephalography was performed to identify electrographic seizure activity following the apparent cessation of convulsive seizure activity. The electroencephalography procedure was performed on each patient before general anesthesia, which was required for additional diagnostic procedures. Depending on the patient's consciousness level, sedation was administered to control movement and muscle artifacts during electrode placement. A video EEG system with a wireless recorder was used for electroencephalographic recordings. The electroencephalographic data were analyzed in real time by a veterinary neurologist and subsequently reviewed by a human medicine electroencephalographer. Based on the 10 to 20 International System for Humans, the researchers used an adapted method of EEG electrode placement. Disposable subdermal needle scalp electrodes were placed to ensure uniform coverage of the head. Electrode resistance was tested to maintain impedance under 10K omega. An 8-channel referential montage was set up, utilizing frontal, central, temporal, and occipital electrodes, along with a reference electrode and a ground electrode. The setup incorporated a standard electrocardiogram, or ECG, channel placed on the main pads of both thoracic limbs. The filter settings range between 0.5 and 70 Hz. The electroencephalographic recordings lasted for a minimum of 10 minutes. Electrographic seizure was defined as epileptiform discharges lasting at least 10 seconds or any pattern exhibiting evolution in frequency, location, or morphology, while electrographic status epilepticus was defined as an electrographic seizure lasting at least 10 minutes. The data collected were analyzed using statistical software. The researchers used several statistical tests to determine the relationships between the variables. From the medical database, the researchers identified 390 dogs and cats presented for seizures of any type. Of these, 26 dogs and 12 cats met the study's inclusion criteria. The median age of the cats was 6 years, and the group included 3 females and 9 males. The dogs had a median age of 6.5 years and comprised 13 females and 13 males. The researchers found that signalment, that is, the animal's breed, age, sex, etc., had no significant influence on the occurrence of electrographic seizures or electrographic status epilepticus. All patients included in the study had a history of cluster seizures, and 3 patients also experienced status epilepticus. Notably, about 68% of the animals had new-onset manifestations with cluster seizures, meaning epilepsy had not been previously reported. Approximately 39% of the animals exhibited a markedly decreased level of consciousness following cluster seizures, making sedation unnecessary for EEG recording. All patients underwent additional diagnostic testing to determine the underlying cause of their seizures. Structural epilepsy was diagnosed in the majority of animals, followed by reactive seizures, suspected idiopathic epilepsy, and seizures of unknown origin. However, the researchers could not identify a significant association between the etiology of cluster seizures and the occurrence of electrographic seizures or electrographic status epilepticus. Turning to the electroencephalographic data, the median duration of the EEG recording was 45 minutes. The majority of patients showed delta background activity. Interictal epileptiform discharges, that is, abnormal electrical activity occurring between seizures, were identified in 42% of the animals. Electrographic seizures were detected in 29% of the patients after the cessation of clinical seizure activity. The time from the start of EEG recording to the appearance of electrographic seizures varied. All animals with electrographic seizures showed nonconvulsive seizures. Of these patients, some had no clinically detectable seizure activity, while others exhibited only subtle signs such as facial, ear, or limb twitching. A decreased level of consciousness was evident in some patients with electrographic seizures, but this finding was not statistically significant compared to patients without electrographic seizures on EEG. The majority of patients with electrographic seizures experienced an evolution in frequency and an increase in amplitude at the beginning of the electrographic seizure on EEG. They showed either periodic or rhythmic discharges in a specific frequency range. In most patients, the last clinical seizure activity occurred less than 12 hours before the EEG. Statistical analysis revealed that electrographic seizures were significantly more likely to be detected in patients with EEGs performed soon after clinical seizures. Electrographic status epilepticus was detected in 16% of the patients. These patients exhibited either persistent electrographic seizure activity or recurrent electrographic seizure activity for an extended time. One dog experienced mild ear twitching during electrographic status epilepticus, but no clinical seizure activity was observed in the remaining cases during EEG recording. The researchers also examined the outcomes for these patients. They found that the mortality rate for patients with nonconvulsive seizures and nonconvulsive status epilepticus was significantly higher than that for patients with no seizure activity on EEG. Euthanasia was frequently requested due to the underlying cause of the cluster seizures or a lack of improvement following anticonvulsive treatment. Of the patients with electrographic seizures, a few survived. These patients were treated with an algorithm for emergency treatment of status epilepticus. However, repeated administrations of medications were often insufficient to stop the electrographic seizure activity, and general anesthesia was required. Anesthesia was initiated using propofol, and inhalant anesthesia was maintained with isoflurane for 12 hours. A little over half of the patients were discharged and received one or more anticonvulsive medications. The results of this study have important implications for veterinary medicine. The researchers concluded that there is a high risk of nonconvulsive seizures and nonconvulsive status epilepticus in dogs and cats with a history of cluster seizures. The prevalence of these conditions was found to be consistent with previous veterinary studies. The high mortality rate observed in patients with electrographic seizures underscores the severity of these conditions. It is important to note that the deaths were not a direct result of nonconvulsive seizures or nonconvulsive status epilepticus, but were related to the underlying cause of the cluster seizures or a lack of improvement with treatment. The study highlights the crucial role of electroencephalography in the early detection of nonconvulsive seizures and nonconvulsive status epilepticus. The researchers found that electrographic seizures were more likely to be detected when EEGs were performed soon after clinical seizures. Given that many patients with nonconvulsive seizures show no or only subtle clinical signs, there's a significant risk of these events being overlooked. The researchers suggest that a substantially decreased level of consciousness following epileptic seizures should raise suspicion for persistent nonconvulsive seizure activity. The study also supports the idea that prompt, aggressive treatment of cluster seizures in dogs and cats can lead to better outcomes. When repeated administrations of benzodiazepines and antiepileptic medications are insufficient, general anesthesia may be necessary. In cases of persistent seizure activity, anesthesia may be induced and maintained with isoflurane, with the goal of achieving a burst suppression pattern on EEG. The researchers acknowledged several limitations of their study, including its retrospective design, the inclusion of 2 different species, and the small number of cats. The variable EEG recording durations also posed a limitation. Despite these limitations, this study provides valuable insights into the prevalence and clinical significance of nonconvulsive seizures and nonconvulsive status epilepticus in dogs and cats with a history of cluster seizures. The researchers emphasize that these conditions are difficult to detect clinically and can only be diagnosed through EEG monitoring. They suggest that a decreased level of consciousness after a convulsive seizure could indicate ongoing epileptic activity. They call for additional prospective studies with larger patient groups and longer EEG recording sessions to further elucidate these conditions and identify optimal treatment protocols. This research underscores the importance of vigilance and advanced diagnostic techniques in veterinary neurology. By recognizing and understanding nonconvulsive seizures and nonconvulsive status epilepticus, we can potentially improve outcomes for our canine and feline patients experiencing cluster seizures. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.